If you're getting pain when you squat, I have good news for you.
What is it?
This is the video that's going to teach you why and what you should do about it.
What am I gonna do about my legs?
I'm Dr. Sean Pastuch, and for over 20 years, I've been a chiropractor and a personal trainer helping people get out of pain without going to another doctor's office or giving up their active lives. All of the concepts I'm going to teach you in this video have been tested and proven in real life with real people throughout my career. There are really 3 reasons why people experience pain when they squat, and why you might be if you're having some right now. It's also important that if you don't have pain now, these are 3 things that could lead to pain in the future. So look at them. The first is that you're lacking the range of motion necessary to do the exercise. Primarily that's going to be in the knees, but sometimes there's also some limiting in the ankles or in the hips. We're going to focus today on the knees. The second is your ability to produce force across your left leg and your right leg similarly. We're going to show you how you can evaluate both of those legs to make sure that you're not going to overcompensate when you squat on one side. And the third thing that we're looking at, I forgot. And the third thing that we're looking at is that you might lack the motor control necessary to create the postures that you want to be at throughout the movement, especially towards the bottom, where you're going to get weak and the weights are going to get even heavier. I'm going to show you how to look at that and make decisions about whether or not what you're doing is good or bad. Let's break down all 3. The first thing we're going to look at is your knees. Go ahead and try to sit like this. Can you do it? If you're able to sit to your heels without any discomfort in your knees, we're probably in good shape to squat. But if you are feeling discomfort or you can't get into this position, you're going to have a really hard time squatting without compensating or causing pain. If you're feeling any discomfort in this position, what I want you to do is notate where it is. Are you feeling it above or below the patella in the front? Or are you feeling it deeper inside of the knee? This is important because what you're going to do to try to make that better is going to depend on where you felt it during this test. The reason why it's important for you to note where you're feeling that discomfort is because the structures that you're feeling are totally different if you feel it in the front or if you feel it on the inside. And the things that we're going to have you do that might make it feel better are going to be the exact opposites of one another to help solve both. The second thing we're going to be looking at is your ability to create strength on each leg independent of the other. We want to see if you have a stronger leg or a weaker leg. Here's how we're going to do it. We're going to set up with a box just like this, and Jess is going to show us the box is above her knee height. So this is the top of Jess's kneecap. That's the top of the box. That's the closest that we want it to be. The box needs to be above your knee height because that's how we're going to approximate the same angles that you're creating when you squat. What we're going to do is grab a bar. We're going to hold it just like this. It should be loaded with 25 to 30% of the amount of weight you can squat for 5 to 10 reps. We're going to start testing the left leg first. Put your foot on the box and do as many step-ups as you can with a faster up, slower down tempo. Careful not to use the back leg to push off of the ground. That's cheating. You're not a cheater.
Yeah, 'cause like cheaters.
When you're done with all of the reps on the left, you're going to record your score and put the bar down to rest so that you can do the same thing on your right, fresh, totally fresh. Remember, this is an assessment. This isn't a workout. I want you to be totally fresh. Write down how many reps you got. We're looking to make sure that your discrepancy from one leg to the other is less than 15%. If you found yourself doing more reps on one side than the other by more than 15%, it's likely that when you get into the gym and start squatting with both legs, you're going to load one leg more than the other, and that's a great way to start injuring yourself. I've been talking about single leg strength discrepancies causing injury or having a predictive value for injury since back in like 2015, 2016. The NFL has finally caught up and started to pay attention to it. Try not to be the person who waits until this is mainstream. Just take my word for it, take their word for it, and start doing this stuff now. And finally, you're gonna film yourself.
Relax. I just want to take some pictures.
So I want you to take a camera and set it up right about here, where you can see yourself from the side. Then all I want you to do is squat a warm-up weight, by the way. This shouldn't be heavy. This should just be enough weight that your body has to get into the positions it would be in when you squat. Come all the way down to the bottom. When you're in the bottom, we're looking for 3 very important and simple things. Your hip is below the crease of your knee. People who tell you shouldn't squat below your knee don't know what they're talking about. They just want to create weakness across the knee when you get into this position. Squat through the full range of motion that you have. The second thing, your spine is static. So when you watch yourself on video, the spine should be staying still. No movement in the spine, not when you're squatting. Third is the spine is in what we call a neutral position. I'm not gonna show you what non-neutral looks like. This is good. I'm gonna have Jess run through a couple of squats right now and hold the bottom for a few seconds just so that we can see what it looks like and see how the spine looks throughout the movement. I'm gonna get my head out of the way so I don't get hit. Go ahead, Jess. Spine stays fairly neutral the entire time. It doesn't move. And then the bottom, the hips are below the knee. This is what you're looking for. Let's get to the corrections. If you had trouble sitting your butt to your heels in the kneeling position we showed you in the gym, I asked you to notate where you felt it. This is why. If you felt it on the inside of the knee, on the back side or deep inside the joint, I want you to go see a doctor and tell them that. I want you to get evaluated for whether or not you have damage to the cartilage or damage to a ligament. It's important. I have seen people get better by spending time in the bottom position of a squat, unloaded and then loaded over time. But I don't want to make that recommendation to you because it could make you worse if it's the wrong thing for you to do. And we won't know. That's a case-by-case thing. This is not medical advice. So please, if you felt it inside of the joint or on the back side of the knee, go see a doctor to find out what exactly it is that you were feeling and then trust them with a plan to help you through it. If you felt it in the front of the knee, I have much better news. Sorry to the previous group. You're probably feeling what we call musculotendinous restriction. What that means is that if the tendon was longer or if the muscle stretched better, you wouldn't have that discomfort. That's much easier to change and the risks of injury are significantly lower. There's a protocol that you can follow. Screen grab it. That's called heavy, slow resistance. And it's some of the most uncomfortable training you're ever going to do. It's way harder than you think it is, way lighter than you think it needs to be, but it works. It works really well. It's empirically studied. There's plenty of evidence, and we've been using it with clients for the better part of a decade and getting fantastic results. The next thing that you might have found you have a discrepancy in was the single leg strength testing. I'll tell you what, guess what? If that's you, you fit into the category of where I found most elite athletes break down. These people could do anything on two legs, all day long on two legs. But when asked to perform on a single leg, not good. And depending on the mental aptitude or the mental capacity of the athlete, when I would tell them that this is a huge area of opportunity, they would either attack it with vigor or see it as a reason to pack it up altogether. No joke, that's a real thing. You are going to be the first version, the person who says, oh, I have a discrepancy from left to right. I have a huge area of opportunity to improve here. So the reasonable question that you might ask is, do I bring up the strength in both legs? No. You want to make sure that you don't lose the strength in the leg that's stronger, so you're going to maintain. And you're going to do everything that you do for the weaker leg, also for the stronger leg. No more, no less, the same thing. That's going to allow you to maintain your strength on the side that's already stronger while you build strength on the other side.
Wrong side!
Any well-written, linearly progressed program will help you build the strength in the single leg that you need. All that means, for those of you who don't follow exercise jargon, is your workouts need to get a little bit harder every time that you do them. The weight needs to go up, the number of reps need to go up, something like that needs to change. So as long as you're following a program that is going to get harder every time that you do it, you are going to be able to take the weaker leg and make it more like the stronger leg so that when you squat with both, you're not leaning to one side. Third thing, let's talk about that squat of yours. Does it look like Jess's? That looked good, right? I mean, let's look at that again. That is a good squat. Okay, so here's the deal. There are a lot of reasons why yours might not look like hers, especially down in the bottom. She's built really well for squatting. Her lever lengths are good. She's been doing it for a long time, so she's very high skilled. But you need to be able to control the ranges of motion in a similar way that she does, or you risk injury. It doesn't matter that you have less experience in different levers. It's not about what's fair, it's about what's real. And deviations from that are likely to lead to injury more than non-deviations like that. There are a lot of reasons why your squat might not look like Jess's. Those oftentimes are going to be best addressed by a coach or by you working with much lighter weights than you want to work with to improve your skill in the movement. Assuming that you have the range of motion that you need to have to do the movement, not being able to get into those positions would be a skill thing. Practice with lighter weights. Instead of trying to maximize your strength, maximize your skill. The number one thing that can get in the way of you making this improvement is your ego. There is no room for your ego here.
Called the ego.
You came to this video because your squat hurts. You want to get out of pain. More skilly, less painy. That's the goal. You're gonna have to do lightweight for a longer time than you want to so that you can go from being bad at this to being average at this. And then if one day you wanna become really great, you'll have to be average for a really long time to suck down that ego pill again to maybe be great at something that frankly I don't think is that important that you're great at. But you're hurting and you wanna be able to get better at squatting without pain, so follow the instructions. Let's recap. That's the recap sign. 3 things that are most likely to be causing you discomfort when you squat. 1, you're lacking the range of motion, most likely through the knees. Someone else is gonna tell you, no, it's the ankles. Whatever, check the knees. 2nd, you struggle to produce the same amount of force in one leg as you do in the other. So when you squat, you overcompensate to one side. You know how to test that now, and you know how to fix it. 3rd, you run into the issue of having bad technique. Your skill sucks. Good news, that just takes time and practice. If you liked what you saw in this video, you know what you're supposed to do. Like and subscribe. I'm Dr. Sean Pastuch, and your pain is a choice. See ya.